Alright, so in this video we're going to cover a drill I'm using to help a patient who's recovering from glute medius issues. The context is that she's already completed PT but is having issues transitioning back to martial arts type movements, so we're borrowing from dancing type work to see if we can kind of bridge the gap, get her back to athletics. Notice we're using a bar for support. This could be a chair. We're also using a band for resistance. Now the reason I'm doing it this way is because, hey, this is my gym setup, but you can easily see how this can be done in multiple environments. Notice what we're doing is slow isometrics with the band, and you can actually play with different variables here. For instance, you can tie the band around your ankle, or you can actually pinch it off with your toes to kind of get some intrinsic foot action going on. If you notice there's a bit of a turnout going on, you can also control for the angle that you turn out or don't turn out your foot to shift that load to where it belongs. And notice here I'm supporting myself with that bar. And interestingly enough, if you really need a lot of support, you could just lean on the thing, right? With the idea being that as you improve your stability, improve your strength, you can lean progressively less and less until eventually you're doing the motion relatively unassisted, right? It's just there for balance. And then when you feel really confident, you can get off the thing altogether and just abduct your leg. At that point, move on to something else.